In the realm of human health, few events are as sudden and as potentially devastating as a heart attack or a stroke. These medical emergencies, often striking without warning, can leave lives hanging precariously in the balance. Yet, despite their formidable nature, understanding the difference between a heart attack and a stroke can mean the difference between life and death. This essay will serve as your guide through these two distinct yet equally serious medical conditions. We'll delve into the intricacies of each, exploring their causes, symptoms, and the importance of immediate medical intervention. By the end, you'll be equipped with the knowledge to recognize the signs and act swiftly, potentially saving yourself or someone you love. Remember, knowledge is power, and in matters of the heart and brain, it can be the ultimate lifesaver. Let's embark on this journey of understanding, empowering ourselves with the knowledge to protect our most vital organs. Imagine a vital supply line, responsible for delivering life-giving oxygen and nutrients, suddenly becoming blocked. This is akin to what happens during a heart attack, where the heart's own supply line, the coronary arteries, become obstructed. The heart, a muscle that tirelessly pumps blood throughout our bodies, relies on these arteries to function properly. This is the stark reality of a heart attack. It is a medical emergency that requires immediate attention and intervention. The symptoms can be sudden and severe, often catching individuals off guard. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a part of the heart muscle is abruptly cut off. This interruption in blood flow can cause significant damage to the heart muscle if not promptly treated. This blockage, most often caused by a blood clot forming within a coronary artery narrowed by plaque buildup, can lead to a cascade of events that jeopardize heart function. Plaque, a mixture of fat, cholesterol, and other substances, accumulates over time, narrowing the arteries and making them more susceptible to clots. This blockage starves the heart of oxygen, leading to potential damage or even death of heart tissue. Without oxygen, the affected part of the heart muscle begins to die, which can severely impair the heart's ability to pump blood effectively. The severity of a heart attack can vary depending on the size and location of the blockage. A blockage in a major artery can cause extensive damage, while a smaller blockage might result in less severe consequences. A small blockage might result in minor damage, allowing for a quicker recovery and less long-term impact on heart function, while a larger one can have devastating consequences. Severe blockages can lead to significant heart muscle damage, heart failure, or even death if not treated immediately. Time is of the essence in these situations, as the longer the blockage persists, the greater the risk of irreversible damage to the heart muscle. Rapid response and treatment are crucial to minimize damage and improve outcomes. Understanding the nature of a heart attack is the first step in recognizing its often subtle warnings. Early detection and prompt medical attention can make a significant difference in survival and recovery. Heart attacks often announce themselves, not with a roar, but with a whisper. Recognizing these early warning signs can be the difference between life and death. The hallmark symptom of a heart attack is chest pain, often described as a feeling of pressure, tightness, squeezing, or a heavy weight on the chest. This pain may radiate to the arms, back, neck, jaw, or even the stomach. However, not all heart attacks present with classic chest pain. Some individuals, particularly women, may experience atypical symptoms such as shortness of breath, nausea, vomiting, lightheadedness, or extreme fatigue. It is crucial to remember that heart attack symptoms can vary greatly from person to person. Any discomfort that feels unusual or persistent, especially if it lasts for more than a few minutes, warrants immediate medical attention. Never dismiss chest discomfort as indigestion or stress. When in doubt, always err on the side of caution and seek medical help immediately. Section 4. When the brain cries out, understanding strokes. If the heart is the engine of the body, the brain is its command center. A stroke, much like a power outage in this command center, occurs when blood flow to a part of the brain is disrupted. This disruption can occur in two main ways: an ischemic stroke, caused by a blockage in a blood vessel supplying the brain, or a hemorrhagic stroke, caused by a ruptured blood vessel leaking blood into the brain. In both cases, brain cells deprived of oxygen and nutrients begin to die rapidly, leading to potential brain damage and a range of neurological deficits. The severity of a stroke depends on the location and extent of the brain injury. Prompt medical attention is crucial, as timely intervention can minimize brain damage and improve chances of recovery. Section 5. Recognizing the signs, stroke symptoms. Understanding the symptoms of a stroke can save lives and reduce the long-term impact on the individual. It's crucial to be aware of these signs and act immediately. Strokes often strike suddenly and without warning, making it essential to recognize the signs and act fast. The quicker you respond, the better the chances of minimizing damage to the brain and improving recovery outcomes. The acronym FAST is an easy-to-remember tool for identifying stroke symptoms. F for facial drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency services. Let's break down each component. F. Facial drooping. Ask the person to smile. If one side of their face droops or appears uneven, it could be a sign of a stroke. Does one side of their face droop? This asymmetry is a key indicator and should not be ignored. A. Arm weakness. Ask them to raise both arms. If they struggle to lift one arm, or if one arm drifts downward, this could be another warning sign. Does one arm drift downward? This weakness or inability to control one side of the body is a critical symptom. S. Speech difficulty. Ask them to repeat a simple sentence. If their speech is slurred, garbled, or they have trouble finding the right words, this is a serious sign. Is their speech slurred or difficult to understand? Clear communication is often impaired during a stroke. T. Time to call 911. If you observe any of these signs, even if they are fleeting, call emergency services immediately. Quick action can make a significant difference in the outcome. Other stroke symptoms can include sudden numbness or weakness on one side of the body, confusion and difficulty understanding speech, trouble seeing in one or both eyes, experiencing blurred or double vision, or even sudden loss of vision can also be indicators. Difficulty walking, dizziness, and loss of balance or coordination are also common symptoms. These can lead to falls and further injury. And a severe headache with no known cause, often described as the worst headache of one's life, can be a sign of a stroke. Remember, time lost is brain lost. Every second counts when dealing with a stroke. Every minute counts in stroke treatment, so act quickly if you suspect a stroke. Immediate medical attention can significantly improve the chances of recovery and reduce the risk of long-term disability. Section 6. Heart attack versus stroke, key differences. While both heart attacks and strokes are medical emergencies that share some risk factors, it's crucial to understand their key differences. Organ affected. A heart attack affects the heart, while a stroke affects the brain. Underlying cause. A heart attack is primarily caused by a blockage of blood flow to the heart muscle, while a stroke is caused by a blockage or rupture of a blood vessel in the brain. Common symptoms. Heart attacks typically present with chest pain, pressure, or discomfort, while strokes often manifest as sudden weakness, numbness, speech difficulties, or vision problems. Long-term effects. Both conditions can lead to long-term health issues and disabilities, such as heart failure, arrhythmias, cognitive impairments, or paralysis, depending on the severity and location of the damage. Section 7. Shared roots, shared prevention, risk factors. While heart attacks and strokes are distinct medical events, they often share common risk factors, many of which are preventable through lifestyle modifications. Understanding these risk factors can empower individuals to make healthier choices and potentially avoid these life-threatening conditions. Age. The risk of both conditions increases with age. As we grow older, our blood vessels naturally become less flexible and more prone to damage, making it easier for plaque to build up and block blood flow. This is why regular checkups and monitoring become increasingly important as we age. Family history. A family history of heart disease or stroke increases your risk. Genetic factors can play a significant role, and knowing your family's medical history can help you and your healthcare provider develop a more personalized prevention plan. Smoking damages blood vessels and increases the risk of blood clots, significantly increasing the risk of both heart attacks and strokes. Quitting smoking is one of the most effective ways to improve your cardiovascular health and reduce your risk. High blood pressure. Uncontrolled high blood pressure puts extra strain on the heart and blood vessels, increasing the risk of both conditions. Regular monitoring and managing your blood pressure through diet, exercise, and medication can significantly lower your risk. High cholesterol, high levels of LDL, or bad cholesterol can contribute to plaque buildup in arteries, increasing the risk of heart attack and stroke. Maintaining a healthy diet low in saturated fats and cholesterol, along with regular exercise, can help manage your cholesterol levels. Diabetes. Diabetes damages blood vessels and increases the risk of both conditions. Managing your blood sugar levels through medication, diet, and exercise is crucial in reducing your risk of heart disease and stroke. Obesity. Being overweight or obese increases the risk of heart disease, stroke, and other health problems. Adopting a balanced diet and regular physical activity can help you achieve and maintain a healthy weight, thereby reducing your risk. Physical inactivity. A lack of regular exercise increases the risk of both conditions. Engaging in at least 150 minutes of moderate-intensity aerobic activity each week can significantly improve your cardiovascular health and lower your risk of heart attack and stroke. Understanding these shared risk factors is crucial for taking proactive steps to reduce your risk. By making informed lifestyle choices and working closely with healthcare professionals, you can significantly lower your chances of experiencing a heart attack or stroke. Remember, prevention is always better than cure. For more interesting facts and tips on health, don't forget to subscribe to our channel and hit the notification bell. Stay informed, stay healthy.